Good evening. Good evening. Are you there?
Yes, sir, I am here.
All right. You're welcome to our today's class. Today we take a look at pharmacology, action and uses of medicines. Action and use of medicine, as we call it in our pharmacy technician program. But it's all about pharmacology, even though it's not pharmacology, because pharmacology is beyond action and use of medicine, just a part of pharmacology. But I call it pharmacology for understanding of what we are talking about. Is that clear? So today
Yes, sir.
we topic we will look at the cardiovascular and renal systems drugs. So drugs for the cardiovascular and renal systems. Remember, in our anatomy and physiology, we started with the cardiovascular system. So we will be looking at them side by side so that you appreciate what we are discussing in anatomy and physiology. So in our anatomy and physiology, we talk about the structure and functions of the cardiovascular system. But in pharmacology, we look at the drugs used in this system. So by way of introduction, I will also do an overview of the cardiovascular system a bit so that you appreciate what we are doing. But before I do that, I want to look at there are some key words and key terms and the definitions you'll be seeing from time to time when discussing the pharmacology of cardiovascular, even anatomy and physiology and pharmacology of cardiovascular and renal system. So I want us to look at these words, then say one or two things about them, and then we will take it off from there. Arrange alphabetically. I want to start with ADH. Do you know the full meaning of ADH? Do you know the full meaning of ADH?
Yes, antidiuretic hormone.
God bless you. Antidiuretic hormone. What do you know about it? Huh?
Filtering of I think it works with the kidney.
I agree.
Filter like for no. Okay, it's like an hormone that stimulates.
So what does it do? From the name, antidiuretic. What does it suggest?
Reabsorb. It works for reabsorbing excess fluid in the body.
Does it cause water to leave to go or to take it back?
It causes water to go.
To go to where? Antidiuretic. Diuretic. What are diuretic? You know that diuretic came from diuresis, right? Hope you know.
No, sir.
So diuretic, what do? They
water retention.
Diuretic.
Yeah, okay. They help in the.
Are you eating or what? Maybe what you are eating is as under your head. You are speaking from both sides of your mouth. You say what?
They help to control the accumulation of excess fluid in the body.
So the fluid, what will it does diuretic help the fluid to leave the system?
I will say yes.
You will say, yeah, okay. If someone takes diuretic, does the person urinate frequently, or does the person stop urinating?
They stop urinating.
Hey, what is going on? It's okay. It's okay. It's okay. It's okay. Let me see. Another name for antidiuretic hormone is vasopressin. Vasopressin. It's actually a hormone that regulates reabsorption of what? Water. Is that clear? It regulates reabsorption of water. So it allows for reabsorption of free water. Is that clear? So excess water. So now, but the point there is that, so what it means is that it retains, it helps, it does not, what the water does not leave the body. Is that clear? So, but the point is that if in that regulation, it depends on what the body needs at that point in time. But basically, it allows for what? Reabsorption of what? Water. Now, as I said before, now is another name is what? Vasopressin. So how does it achieve that? How does it achieve that? There is something, there are channels known as aquaporins. Aquaporins. So these hormones help to control the insertion of, you know that this reabsorption takes place in the collecting ducts. Collecting ducts. Now, this hormones controls the insertion of aquaporins into the what? Collecting ducts. And when that happens, the collecting ducts now, in response to the effect of this antidiuretic hormone, will now allow for what? Absorption of what? Free water. So the aquaporin is the channel through which this absorption takes place. And these hormones help to do what? Control the insertion of this what? Aquaporins into the collecting ducts. Is that clear? Is that clear? Let me not go deep. Let me not go deep in just to say one or two things about this, so that when we start mentioning it in the course of these topics, they will not be new to you. That's why I'm doing this. Then another, okay, I have talked about aquaporins now. So what I was,
can you say that aquaporin?
Aqua, A-Q,
A-Q.
A-Q, U-A. From aqua now, aqua is water now, aqua.
Yeah.
Then porins.
Aquaporin.
P-O-R-I-N-S. Porins.
Yes, got it.
Now, so what I was describing antidiuretic hormone, I had already talked about aquaporins. These are just channels. They are channels that are inserted here into the collecting ducts. Remember how antidiuretic hormone helps to do what? For this insertion. So when they are inserted now, they will allow for reabsorption of what? Free water. So that's what aquaporin does. Then the next term, please mute your mic. Mute your mic. When you want to talk, you can unmute it, please. So the next term I want us to talk about is arrhythmias. Arrhythmias. You are familiar with this one now. So what do you understand by the term arrhythmias?
I know that it is an heart disease.
Is what? Huh?
Arrhythmia. I know that it's an heart.
Yeah, I agree. So what is it all about? I agree with you, but what is it all about? You know, our heart beats now. The heart beat maybe 2 high, it may be too low.
Okay. Low.
Right? So
Yes.
if it is too high, it's
Bradycardia.
abnormal. If it is too low, it's abnormal. So abnormal heartbeats. Of course, you know what heartbeats is. You know what causes heartbeats now. Remember, during the contraction. Remember. So arrhythmias is what abnormal heartbeat. That's why in arrhythmias we have bradycardia, we have tachycardia. You have heard of those terms, right?
Yes, I have.
So we have bradycardia, we have what tachycardia. So arrhythmia talks about what abnormal heartbeat. Now, another term is arteries. So you should know this one now. So what are arteries? Huh?
They are
What
the
are
vessels
arteries?
that take. They are the
Huh?
vessels that take blood. They take blood away from the heart.
God bless you. They take blood away from the heart. Good. So what of arterioles? What about arterioles?
They are they
Yes,
are tiny trees that helps arteries in the. I don't know the
you say
mechanical
what?
the definition. I
Why
don't know
does it
the
take you time to
definition of
answer?
the
Are you are
arteriole.
you are you looking
I'm
are you looking it up somewhere? Huh?
no, except that,
Huh?
no, sir.
So why does it take you time to answer? Uh-huh. Arterioles, uh-huh.
So I don't know it.
They are tiny what blood vessels. I agree with you. So arterioles, they deliver blood to where? The capillary bed. So arterioles are tiny blood. They are nearly microscopic. They are tiny blood vessels. So what it means that if arteries take blood from the heart going down before it enters a particular tissue, it now comes as what? Divide further as what? Arterioles, tiny. So is arterioles is the one that now end up as what? In capillaries, because the capillaries is where the exchange takes place. Is that clear? That's where the nutrients from the blood, the oxygen from the blood is in the capillary. That's where that exchange will take place. And also in the capillary, we have the venous. Venous is the end, the beginning of what? What drains blood that contains waste products, CO2, and other waste products drain to what? The vein, the venous, from the venous. So that means capillaries, it consists of arterioles and venous that linked together. So in that place now we have the surround each in each of these tissues, so that at this point we now have where we have exchange. So the what is coming out, waste products will now come in after the exchange. Now the blood that has what waste products will now drain from the veins into the veins. From veins they will now go to the heart again through the superior and inferior vena cava. Let me stop here. Let me not go deep. The next term is atrium. Atrium,
So what do you call it? Atrium.
atrium, trium,
Trium. Okay.
atrium. Anyone? Atrium. Anyone can call it. Atrium. What now about? No, if you don't know it, just say don't know it. So we move ahead. So we don't waste time. I'm asking you this
So
question
what
so you
I
can
know about
participate. I want.
I know
Uh-huh.
about atrium is that we have right atrium and left atrium, and we have ventricles, so right ventricle and left ventricles. So
Mhm.
the oxygenated blood come from the right atrium.
Huh?
So the
You
oxygenated
say what?
blood, the oxygenated
The
blood,
okay,
deoxygenated.
I
So
agree
it
with you.
comes from, okay. So that's what I know about it.
Okay. Atrium is one of the chambers of the heart. Is that clear? So
Okay.
it's the upper chamber of the heart. There are two, right atrium and left atrium. So atria. So atria are the upper chambers of the heart. So we have the right atrium and the left atrium. Just as you say, atrium for the right atrium, blood, deoxygenated blood coming from lower limb, entering this inferior vena cava, the one coming from the head down to through superior vena cava. They will enter the what? The right, the what? The right, where they enter? The right what? Atrium, right?
Yes, sir.
So from the right atrium, what happened? Okay, let me not go further. Let's stop here. What of bladder? Hmm?
I'm coming now.
You are coming.
Sir, do you mean urinary?
Uh,
Sir, do you mean
you are
urinary
you are
bladder?
you are looking up the answer. You
So I'm
say you
not
are
looking
coming.
up the answer. Oh.
You say you are
No, it's
coming.
because I don't know if this thing is muted or not.
Okay, oh
I
yeah,
did
blood
not
and
see
come,
if it's muted.
blood and
Is it
come.
urinary bladder?
Okay, yeah, let me be too specific. Urinary bladder.
Urinary bladder is when urine is stored. And yeah, urinary, the bladder, if they say bladder is full, that means the urine is full in the bladder.
Good. It's
So
where is the organ where that stores what urine before what excretion. I agree with you. What of capillaries?
they
What of
are
capillaries?
tiny, they are capillaries are tiny. What will I call it now? They're
Capillaries
like
and
tiny vessels. They are like
capillaries,
tiny vessels.
capillaries and arterioles. Which one is bigger?
Ah, arteries should be bigger than
I said
yeah,
arterioles.
okay, arteries. Ah,
Capillary and arterioles.
both of them are small.
Which one is bigger?
Capillaries.
Capillary is bigger than arteriole. Uh,
Arterioles will be bigger than capillaries. You are confusing me.
all right, all right, all right. So capillaries are actually the smallest blood vessels. The
Okay.
smallest blood vessels. So that is where cellular exchange takes place. Is that clear? I think
Yes.
I have explained this before, all right? The next one, you are familiar with this one now. Cardiovascular system. It's just a body system that is made up of what? The heart, the arteries, veins, and is responsible for what? Transport of blood, nutrients throughout the body. So this one is not new. What of coronary arteries? What of coronary arteries? What do you know about them?
Coronary artery will be, oh, I read that
Huh?
during exam. Coronary artery is when the I forgot. I don't know if it's when the heart muscle cannot pump blood or when the heart
What are
muscle
you
does
saying?
not have enough energy.
What
Abi
is Alice saying?
abi coronary artery. I
Uh-huh.
don't know it. Maybe I'm mistaking them.
Say what?
Maybe
Okay.
I'm mistaking the term for another thing.
Okay, please. Coronary arteries, they are the arteries that surround the heart. They are the arteries that surround the heart. So they are the arteries that supply blood to the heart. Is that clear? They are surround the heart. So just know that. So and the next term is you'll be meeting. Why I'm doing this is that in the course of this topic, you'll be meeting these terms. In fact, even if you get any textbook to read, you'll be meeting these terms. That's why I'm taking it one after the other. Then, but next one is coronary artery disease. This one is just from the name, you know what it is. This is what a disease condition of the what the coronary artery. So this is simply a disease condition of the what coronary artery. So, but what happened in this disease condition? This coronary artery disease occurs due to what? When the coronary artery becomes narrowed. When the coronary arteries, the arteries that supply the heart muscles, the heart, when the artery becomes narrowed, that means the lumen is narrow, small narrow space inside the lumen of the what? The the vessel, the artery. And a lot of things can cause it. Sometimes um, plaque from maybe plaque from what is it called? We have what's called sclerosis, maybe from fats or whatever can block it, can block it. That's why they say that those that are above 40 years, they recommend them to use to be using what is it called? To be using um vasoprene, low dose aspirin. You know about that one, right? So
Yes.
so so movement. So this narrowing of lumen can make movement of blood inside that coronary artery to be disturbed. And when this happens, there will be decrease in blood supply, and that decrease in blood supply can ultimately lead to decrease in oxygen supply to the heart muscles. And you know that if oxygen supply is low, a lot of problems may come up. But this may lead to angina, even what is it called? It can lead to angina, or even myocardial infarction. The heart muscles will start dying because there's no oxygen. You know that oxygen is necessary for what? Respiration. And if oxygen is not there, there will be no respiration will go down. And if respiration is affected, what it means is that this whole thing and what is it called? Um Energy will not be released. Energy will go down in form of ATP. And when this happens, the muscle cells will start dying because they cannot survive. So that is the what coronary artery disease. We still discuss it, but I just want you to know to have a rundown of what all these things mean. Is that clear?
Yes, sir.
Good. Even if this is the only thing we achieve today, we have run down the cardiovascular and renal system. By the time we go in deep into the topic, you will appreciate what we are just doing now. Okay. Now the next time I want us to look at is creatinine clearance. What is creatinine? What is creatinine clearance? What is it? Is it all about? Hmm? Are you there?
Yes, sir. Yes, sir. Yes, sir.
Tell me now.
Creatinine. I've had the um the word before. So I don't know if it's a
Okay,
a waste product.
when you say creatinine, so where does your mind go?
Kidney.
God bless you. Kidney. Thank you. So creatinine clearance is used to measure kidney function. It's used to what? Measure what? Kidney function. Creatinine on its own is a byproduct that needs to leave the system. It needs to be cleared from the system. So how this kidney function, please mute your mic. Kidney function, how functional and how strong the kidney is can be determined using clearance of what? Creatinine. In terms of, here you talk about what? The volume of the plasma that the kidney was able to clear the creatinine content. I told you that creatinine is a metabolic what? It's a metabolic byproduct. So the volume of blood or plasma that the kidney was able to clear of what? The creatinine gives you a kind of, in a given period of time anyway, gives you a clear picture of how functional that kidney is. So the kidney function, if you want to go and do kidney test now, they must do your creatinine clearance. Is that clear? They must do it. Now the next one is diabetes insipidus. Diabetes insipidus. What is it? It's all about? Even in your primary school or secondary school, let me say secondary school. This diabetes insipidus is what you discuss even in your biology. So tell me, what do you understand by the term diabetes insipidus?
Sir, that
Uh-huh.
insipidus, I have heard it before. The only thing I've had before is
Mm-hmm.
diabetes mellitus, which is
And
um
that one then,
high glucose in the blood. So
uh,
diabetes insipidus, or what do you call it?
insipidus.
Ins- insipidus.
Yes.
Mm. Is it related to the kidney too?
Yes. Okay, let me not waste time. Diabetes insipidus occurs due to lack of what? Either lack of production of antidiuretic hormone. So if there is lack of production of antidiuretic hormones, or there may be production, but the body does not respond to the effect of that antidiuretic hormone. So whether the body, the second scenario is that the body does not respond to the antidiuretic hormone that is available. If the next one is that it may occur because the body, there is no production of the hormones at all. So in either ways, it can lead to what? Diabetes what? Insipidus. So let me know what you think. If antidiuretic hormone, if diabetes insipidus occur due to lack of antidiuretic hormone, what do you think is diabetes insipidus? To answer this question, you must first of all know what antidiuretic hormone does before you can answer this question. So tell me. So if diabetes insipidus occur as a result of what? Lack of antidiuretic hormone or presence of antidiuretic hormone, but the body does not respond to it. So what does diabetes insipidus, what is it all about? Just a one sentence can answer the question.
The person If there is an issue with the ADH, so the
Mm.
person will have issue with either
Uh-huh.
you it can be excessive urinating. The person will
Give me
passing
high
out too
five.
much water.
Give me a high
High
five.
five.
Good.
I did not see you now.
Good. Give me a high five.
Thank
Good. I like that. Like that. So don't worry. With this thing now, if you understand whatever we are doing now, you have already understood this topic. Any other thing you are doing, just to. That's why I'm laying this foundation, because these terms are very important to understand the terms. Is that clear?
Yes,
Is
sir.
that clear?
Yes, sir.
Okay.
Yes, sir.
Now, the next term is dialysis. Dialysis. So what is it all about?
Ah, dialysis is what they undergo if there is kidney failure. If
Huh?
there is kidney, is the treatment that people undergo when there is kidney failure.
So what does it entail?
Mm, in order for the kidney to be able to work, so they have to.
Okay, let me help you. In fact, in summary, each time somebody has a, what is it called? Excuse me. Okay, in summary, if somebody has kidney issues, so to get a point that the kidney does not perform optimally again. Excuse somebody, let me admit to somebody. Who is this? Victoria. Who is Victoria? Please put your video. Let me know this name is Victoria. Put your video. This name is hello. Put your video, Victoria. Immaculate Victoria, please. Oh, if I catch you, I will knock your head. How are you? I told people to be using your name. Which one is Immaculate Victoria again? Use your name, please. Did you hear me? Use your name, please. All right, all right, all right. Let's continue. So I said, the in the dialysis, it just basically what happened is that that the body, the kidney, or has already, when somebody start having kidney issue, the kidney, please mute your mic. The kidney does mute your mic, please. The kidney does not perform its work optimally, and when the kidney fails to perform its function, there will be accumulation, edema, and everything will start into it. Now, as they are going for this dialysis, they just artificially use machine artificially to perform the function of what? The kidney. It's when they do dialysis for a long time, and the dialysis does not help out again. That's when they start thinking of kidney transplant. And kidney transplant is the last option. And if the kidney transplant fails or they couldn't do it, the person will now be left in the hand of God to decide the person's fate. Is that clear? Is that clear now? So that's what dialysis is all about in summary. Okay, now the next term is diuretic. Diuretics. So what are the diuretics? Uh-huh. Victoria, you are a latecomer. We are discussing. We are discussing. We are in pharmacology. You have already seen the topic. The what is it called? The cardiovascular and renal system drugs. But we started with definition of terms. We are explaining some terms that you encounter in this topic, so that when we start mentioning them, you not start asking me, sir, what does this one mean? Or when you open your textbook to read the topic, it will not be something new or something alien to you. So that's what we are doing. So now we are talking about diuretics. So tell me, what are diuretics?
Okay,
Yeah.
diuretics are drugs that remove fluid from the body. They help to expel fluids
Is that what?
from the body. I said they are drugs that help to remove fluids, excess fluids from the body, thereby reducing the blood pressure.
Okay, thank you. Thank you for that. So this is what we mean by what? Diuretic. Is that clear? So they increase what? Excretion of water in the urine, basically. Okay, what of electrolytes? Electrolytes
I just want
income.
to attempt. I
Okay,
think they are.
eh?
I
I'm
think they
listening.
are. I think they are essential, like call it elements in the body that is needed for normal function.
Electrolytes, elements. What are you saying?
I don't know I don't know what to call it now, but they are essential or some should I use substance?
Okay, you try, Sha. You try. All right. So actually, electrolytes are just call it anyway. But they come as first of all, you see them as maybe electrolytes are substances. I agree that when they dissolve, first of all, they have to dissolve. They are in liquid form. When they dissolve, generate electric charges. So you have something like they are they are in the solution like ions. Is that clear? You see something like sodium ion, maybe in a solution of sodium chloride in a salt form, in dissolved in liquid, in water. You see them as charged particles. You have sodium ion in the solution, potassium ion, calcium ion. All those things in the body, they have a lot of role to play in the body system, ranging from balancing what happens intracellularly and what happens extra extracellularly. So which of these electrolytes are found more in the intracellularly, and the one that are found more extracellularly? Do you know? You know what this is now. I believe you must have done them. Okay, between sodium ion and potassium ion, which one are found intracellularly more, and which one is found extracellularly? This is your physiology now. We are talking about which one?
I think potassium is found more intracellularly.
You say what?
I said I think potassium is found more intracellularly than sodium.
The sodium is found more extracellularly. Victoria, do you agree?
Yes,
Are you sure? All right.
yes.
So what am I saying here now? Even in nerve impulses, transmission of nerve impulses, these electrolytes are very important. So, in fact, somebody that have issues with the electrolyte balance is as good as loss of electrolyte. The person is as good as dead, because a lot of things will go wrong in the system. So let's keep it there, because we are just We are just defining terms. I don't want us to go deep. What of glomerular filtration rate? What is it all about? Glomerular filtration rate. It's not a new term. Glomerular filtration rate.
Okay, let me attempt.
Yeah, it's
Good.
used to measure blood.
Huh?
GFR is used to measure the blood in the body.
Yeah. Who else?
Measure our kidneys.
Who else?
What I wanted to say is that the glomerulus is found in the kidney, and it filters fluid or anything that is coming into the kidney. So it will filter it to get filtered at that place before it gets to other tubes in the kidney. So I think it's the rate of filtration, like the amount of things the glomerulus, I don't know if I'm getting the pronunciation, is able to filter.
Okay, I think there's a sense in what you just said now. Okay, now let me just put it straightforward. Glomerular filtration rate talks about it measures the amount of blood that is filtered in the kidney per minute. Is that clear? So the amount, just as you said, amount of blood filtered by the kidney under 1 minute gives the what? The glomerular filtration rate, GFR. What of glomerulus? What do you understand by the term glomerulus? Glomerulus, oh yeah. No idea. Okay.
I know that
Uh-huh.
it is part of the kidney too.
Uh-huh.
So it's like since it's glomerulus, let's say it's a tiny maybe tiny vessels in the kidney that help to filter blood because of
Yeah,
the
they are tangled mass of capillaries that is located in the kidney. You know that, remember that is blood. Remember, blood enters the kidney. Remember that blood enters the kidney. So the blood that enters the kidney need to be filtered off. So whatever it after the filtration, remember that blood, remember from cells, waste product of metabolism enters the blood, remember, and in the capillary from the cell tissues in the capillary. Then from there now they drain to veins. Now this blood is taken to the kidney where those waste is what filtered off. So the blood that will now leave will now be one that is be cleared of all this waste. Remember, it's the same blood that will still go back to the heart to be what? Oxygenated. Am I communicating? And is if you get oxygenated, remember blood is also supplied gets to tissue. Remember that's so all this whole process is going on outside the kidney. Those one there, but within the kidney now, this blood now is filtered. All the nyama is filtered out. So the glomerulus is a tightly tangled mass of what? Capillaries. Let me not go deep on that, but just understand. Remember the diagram of your Bowman's capsule. Inside the Bowman's capsule, You know, you remember, right? Remember, right?
Yes, yes.
Let us not go deep on that. What of if you're asked now what are the kidneys? What are you going to say? What do you understand by the term kidneys? What are kidneys? You hearing kidney up and down, kidney, and you go for interview and they'll ask you, please. You expecting you be expected to ask you one big question. They just ask you, please, what do you understand by the term kidneys? What are you going to say?
I'll say kidneys are organs in the body. Um, they are the function is to filter materials like I, I don't know how I'm going to do this thing now. Okay, let me start again. Kidneys are organs in the body that helps to expel unwanted products like waste materials from the body in form of maybe through urine. And there are two, the left and the right kidney.
Okay. Please, each
I
time
say
you
that.
ask to talk about an organ, try to talk about their shape, if possible, their size. Mention those they're very important. Is that clear?
Yes, sir.
So for kidney now, you can simply say that the kidneys are pair. They are what? Kidney is a pair of what? Pair of organs that have what? Shape of beans. True of us, they are bean-shaped what? Organs. All these things you have without running helter-skelter is a simple thing. Simply say they're responsible for what? Urine production. Is now when you are asked how do they help urine production. That's when you start breaking down all these stories you have been telling. Just simply say they are is a pair of what? Bean-shaped pair of organs that are responsible for what? Urine production, not just urine production. They're also responsible, play role in what? Vital role in what? Electrolytes, water, and pH balance. Electrolytes, water, and pH what? Balance. What of nephron? What of nephron?
Nephron is a vital organ in the kidney.
You say what? You have committed physiological blunder, anatomical blunder. In fact, you need to be arrested. Accept. Say it again.
Nephron is one of the units like in the kidney. Nephron and kidney, they are together because when we draw kidney, we used to label nephron.
Any other? You tried now, but the first one you say was you said that you said that the nephron is the organ inside the kidney. Okay, you cannot be an organ now. Okay, you just the functional unit of what? The kidney. So that means the kidney has a lot of nephrons. Is that clear? Is that clear? Yes. Each of them undergoing the ultrafiltration. Ultra what? Filtration. So it's not just one. Inside the kidney, we have a lot of nephrons carrying out this ultra filtration. So nephron is the what? The functional unit of the kidney. So this is where the blood is filtered. Remember, that thing you draw. You see your Bowman's capsule. You see glomerulus inside the Bowman capsule. You see efferent and afferent. You now see the loop of Henle, right? Remember, convoluted and distal. All those that single thing you see is a nephron. Am I communicating? Am I communicating?
Yes, sir.
So what you understand by the term? Is in the nephron that what blood is filtered and urine is what produced. Please note that point. What you understand by the term nephropathy? So if you hear it, if they ask you now, what do you understand by the term nephropathy? What is it all about? Nephropathy. In fact, let's not waste time. Once you
Is
hear
it
party, is talking about disorder.
nephropathy?
Is
Is it
that
like
clear?
nephron
It's a
damage?
disorder. It's a disease. It's a disorder. Is that clear? It's a disease. It's a renal disease. So whatever caused it is not the issue now. But know that it talks about what renal what disease. Am I communicating?
Yes, sir.
So the next time is pH. So this one you don't need pharmacology or anatomy to answer this one. What is pH? Anybody that did chemistry should go to define pH. What is pH? What is pH? I'm listening. What is pH?
It is used to measure the acid or base of a solution. It's used to
Any
measure.
other idea? Uh-huh. I'm listening. Okay, pH is simply a measure. It's a measure of what? Acidity or alkalinity of a solution. It's a measure of what? Acidity or alkalinity of a what? A solution. So the scale starts from 0 to 14. So from 0, if you hear from 0, those are the from 0, 1, 2, those one are the highly acidic. 0, 1, 2, 3, 4. As they are going up 4, 5, 6, the acidity will start going down. You go to 7. 7 is neutral. Then from 7, start going up. You start becoming alkaline. So 14 is very, very alkaline. 13, 12. So that is what is it called? pH is all about. Let's stop here. I'm not going deep. So each time you hear renal, what comes to your mind? Renal.
Kidneys.
Kidney. Relating to what? Kidney. So renal is one of the terms I want you to get acquainted with. Then what of renal corpuscle? Renal corpuscle. Corpuscle, C-O-R-P-U-S-L-E. Corpuscle. Renal corpuscle. What is it all about? We have 7 minutes to go. Let's see if we can. I'm listening. Renal corpuscle. What comes to your mind when you hear the term renal corpuscle? Any idea?
I know that corpuscle means blood. So renal corpuscle can say that where
You
blood
say what?
where
You
the
say what?
blood is
You say what? You say
where
what?
blood plasma.
No, please don't
I
go
thought
there.
it was like blood.
I have already, if you are listening to me, I have already talked about it when I was describing the nephron. It's a component of the nephron.
The bone marrow, that's the
So
bone marrow capsule.
huh?
Like disease of the bone marrow capsule. That's it.
Good. It's a component of what? The nephron. In fact, it is made up of what? It is made up of what? The glomerulus and the bone marrow capsule. So the glomerulus and the bone marrow capsule make up the what? The renal what? Corpuscle. Is that clear?
Yes, sir.
Is that clear?
Yes, sir.
Good. What of renal tubule? If you hear renal tubule, what comes to your mind? Renal tubule.
Those tubes, the tubes in the kidney, like the distal convoluted tubules and the other tube.
So in summary, can we say that the nephron is made up of the renal corpuscles and the renal tubule? A nephron.
Yes. Yes.
Can we say that a nephron has two parts, renal corpuscles and the renal tubules? Can we make such statements?
Yes.
Good.
Yes.
So why the renal corpuscle is made up of the glomerulus and what? Bowman's capsule.
Bowman's capsule. Yes, sir.
Then the renal tubule now, you now have things like proximal tubule, loop of L, distal tubule, and collecting ducts.
Yes.
5, how many parts? 4 parts, right?
4 parts,
Yes,
yes.
The renal tubule has the what? Proximal tubule, loop of L, distal tubule, and what? Collecting ducts. We have described, in fact, we have dismantled a nephron now. By the time you go deep into it now, it not been something new to you. Is that clear? Is that clear?
Yes, sir.
So what do you understand by the term systemic vascular resistance, SVR? Systemic vascular resistance, SVR. If you hear systemic vascular resistance, for you to understand what this means, you should be able to even know what vascular resistance is. What do you understand by the term vascular resistance? Before you can go to systemic vascular resistance. So what does vascular resistance mean? Each time we hear resistance talks about what? Opposition, right? So
Yes, sir.
blood flows in the blood vessel. So anything that will oppose flow of this blood in the vessel is talk about what? Resisting. It resisting the flow. So the vascular resistance is what? Any opposition to blood flow. So if you hear systemic vascular resistance, you talk about all the factors, total forces that oppose the what? Blood flow. Is that clear?
Yes, sir.
Yes, sir.
In the kidney, we have been talking about tubular reabsorption. Tubular reabsorption. What is tubular reabsorption? What does it mean? Tubular reabsorption.
It is when those the essential nutrients now that the kidney wants to expel.
You say what?
The essential. I said when the kidney or when the essential part of whatever that it is that the kidney wants to expel is being reabsorbed. Like there's a place it will get to in the tubules that, for example, water. For you to regulate for you not to lose too much water, the kidney reabsorbs some amount of water and expel some. Like the useful ones, the kidney will take it back and then expel the other ones that are not good.
Okay, in summary, tubular reabsorption, you just talks about is a process is carried or movement or transportation of the filtered substances from the renal tubules back into the blood stream. Is that clear? When the filtered substances are moved back into the what? From the renal tubule back into the, when they are moved from the renal tubule back into the what? Back into the what? The bloodstream. So we say that reabsorption are taking place. What of tubular secretion? tubular secretion. This what happens when substances are released or transported into the what? The renal tube. Substances from the peritubular capillaries, they are now moved into the what? The renal tube. Renal tube. So you say that what? Tubular secretion has taken place. What is a urine? What is urine?
They are
What
wastes
is
that the
urine?
kidney, that they are wastes
Huh?
produced by the kidney. Urine are wastes produced by the kidney.
Waste produced by the kidney. Okay. Okay. Yeah.
After taking the nutrients to the blood system, so urine are the wastes
Yes.
that have to go out.
Okay. Good. So urine is a filtrate. Is that clear? Urine is a filtrate of blood containing waste. So that is why if you start seeing blood in the urine, there's a problem somewhere. You start seeing some things that are not supposed to. It should be a filtrate. So if you start seeing some things that are not supposed to appear in the blood, in the urine, that's a problem. So it's a filtrate that contains waste products and excess materials. Those ones are soluble on their own in the fluid. So they are what? They contain excess waste. They contain waste and excess of materials that are eventually what? Excreted, removed from the body. So urine is actually filtrate of ultrafiltration. So urine is a filtrate of ultrafiltration that takes place in the nephron. Does it make sense? So if you hear the term vasculature, what comes to your mind? If you hear the term vasculature, what comes to your mind? Vasculature. What comes to your mind? If you hear the term vasculature, what comes to your mind? Vasculature of the heart vasculature, the GIT vasculature. What comes to your mind?
Blood vessels.
God bless you. Blood vessels, simple. Simple. Blood vessels. GIT vasculature. That is the blood vessels in the gastrointestinal tract. What they are, their names and what they do, everything, their network. Is that clear? So what are veins? What are veins? What are veins?
Blood vessels. Veins are blood vessels found in the body that transports the oxygenated blood.
You say what?
Back to this. I said veins are blood vessels. Veins are blood vessels found in the body that transports the oxygenated blood.
To where? To where?
To the lungs.
To the lungs.
And for oxygen.
Victoria, how many of you are there? I'm hearing two voices. Two conflicting voices there. You say what? Okay, so let us not waste. You try, Sha. Let's not waste time, okay? It seems just there are blood vessels that carry blood towards the heart. Simple. So they now go to the heart and they do their thing from the heart. Of course, what happens is that in fact the destination is actually the lungs, where they will get oxygenated. The destination is actually the lungs, but they pass through the heart to get to the lungs. when we get there, we will explain that. Is that clear? What are ventricles? Ventricles. What are ventricles? They are part of the chambers of the heart. Huh?
They are, I said ventricles are actually two types, the left and the right ventricles, and they are parts of the, I think they are found in the heart, like one of the chambers in the heart.
Part of what?
The heart,
Uh-huh.
the chambers of the heart.
Uh-huh.
So the left ventricle pumps blood, like it helps in systemic circulation, while the right ventricles, what does that want to say? Receive blood from the right ventricles collect blood from the lungs.
Right ventricle.
It collects blood from it collects oxygenated blood from the lungs.
Uh-huh.
And then it's now moving to the left ventricle for systemic circulation.
What's happening to you? Your voice is tiny. What's going on? Is it from your phone? I can't hear it clearly.
Can you hear me now?
Yes.
Okay,
Continue.
I said that the left ventricles does systemic circulation, while the right ventricles collect oxygenated blood from the lungs. Then it pushes it to the left ventricle for systemic circulation. And the left ventricle is more muscular because of the it does more work, like pushing the blood to all part of the body.
So right ventricle does what? You say that right ventricle does what? Sorry again.
I said it collects blood, oxygenated blood from the lungs.
I disagree with you. I don't agree with you.
Is it that it moves the oxygenated blood to the lungs?
Okay. Deoxygenated blood, they enter the right atrium. Do you agree?
Yes, sir.
Through the superior and the inferior vena cava. Do you agree?
Yes, sir.
So the right atrium takes blood to where? Takes the deoxygenated blood to where? Where the blood that enters the right atrium, where is the next place they will enter?
Right atrium, left atrium. To the right ventricle.
So if they enter, so what blood enters the right ventricle now? Is it oxygenated or deoxygenated?
It is deoxygenated.
So from the right ventricle, where will it enter again?
To the left atrium.
Wagam.
No, sir. No, sir. It will go it will go to the lungs. It will go to the
So
lungs for oxygen. Then it will not enter
the coming down through, how can it get to the lung from the right ventricle?
through the pulmonary artery.
Okay, from the pulmonary artery, it will enter the what? The lungs, right? Good.
The lungs, yes.
And so after oxygenation now, which one now enters where the blood from the lungs will enter where next? The one that is now oxygenated will not enter where?
The right atrium. It will enter the left atrium.
Through what? Through what?
Pulmonary vein.
Through pulmonary vein. It will enter where?
Yes. Right atrium.
No,
Left
sorry,
atrium.
left atrium.
So
Left
from
atrium.
from left atrium to where?
To the left ventricle.
So from left ventricle to where?
Systemic circulation.
Where exactly? Where exactly will it enter first before
Jesus Christ.
I'm only preparing you. I'm preparing you people's mind now. From the left ventricle, it enter the where now. Is from where it?
The different blood vessels will now take it. Like
What is the next?
The arteries.
What is the first vessel it will enter from the left ventricle? Ascending aorta.
Aorta.
Ascending aorta. Ascending aorta. Ascending aorta. Say it.
Ascending aorta.
So have you seen why I say I don't agree with you? How can you tell me that the right ventricle takes oxygenated blood from the heart? In fact, you need to be jailed for this anatomical crime you just committed now. All right, so what of venules? So in summary, ventricles are the lower heart chambers. We have 2 heart chambers. We have four heart chambers. The atria are the upper heart chambers. Left atrium, right atrium, and left atrium. Atria. They are the upper one. The lower one are called the ventricles. Right ventricles and left ventricles. So ventricles are actually the large. They are large. They are larger than the what? The atria. So they are the lower heart chambers. Is that clear? What of venules?
They are the smallest part of vein.
So what happened now? You can if they ask you what is venue, you just say venules are smallest part of vein. You keep quiet. What happened? What did they do?
They transport. I don't know, but I think they are. It's after that the ventricles, the ventricles. Yes, you will see the capillaries.
Afterwards, ventricles.
I don't know how to pronounce that.
Is your own ventricles that is at the capillary bed. Is your own ventricle. Alice, are you with us? Alice, are you with us?
Yes, I am with you.
You hear the blood that she's committing here? Is your own ventricles, Victoria? My own is in the
We are
heart.
committing it together.
Okay.
We are committing together.
Is that what? Is that what?
I say I am committing the brother with her too. We are committing it together.
Okay. Let's conclude. These ones, the Venus, just as you said, that is smallest. Venus, they are the smallest veins. Exactly. In fact, after the capillary bed, after the artery, you have arterioles. We have capillary. After capillary now, the next is venous. Then before we now talk about the veins. So capillaries, the venous drain blood from the capillaries to what? The veins. From the capillary, they drain blood to the vein. Of course, the blood that they drain now is blood that came after the exchange. So that means they contain the waste products, wastes, and the carbon dioxide. So they contain deoxygenated blood. Hope you know. Hope you know, right? So the vein, is that what? I say that in the structure of a structure of the capillary bed. Capillary bed, Lucas, sound more like just as arterioles is to arteries, venules is to veins. Arterioles get blood to the capillary bed where exchange between the capillary and the tissue takes place. The cells take place. Is that clear? Now, this blood, after the exchange, now what enters the blood after the exchange? Now, the blood that have the nutrients and the oxygen will enter the cells, right? The one that comes out, we have more of, we have carbon dioxide and the other waste, right? The venues now we drain, we call it drain now. It's not supply again. It's arteries that supply. The venues will now collect those blood and channel them to the what? The veins. The vein will not take them to the heart. Is that clear?
Yes, sir.
So that is this is where we'll stop our class for today. In fact, we have stayed there extra 16 minutes. All right. Any questions so far? Any question? Any question?
No from me. No.
All right. In the absence of any question, we'll stop it for today. It's late already. All right. Thank you very much for coming around. See you next time. God bless you.
Amen.
Good
Good night,
night.
sir.